Hi, everybody. I am not Kim Berry, and I'm not in Kim Berry's house this time. If we have not met yet, I'm Amanda Decker. I'm a nurse practitioner. I work in Tennessee. I do work with Dr. Berry. He helps me out at my clinic, Clear Path Medical. We're in Middle Tennessee, about an hour west of Nashville. If I have not met you yet, I am excited that you're here with me this afternoon. While Dr. Berry is off doing some civic duties, trying to help Tennessee be healthier, I'm filling in for him about once a month on some Mondays, here to answer your questions and bring in some special guests that I think that you will be excited to hear from. Now, my lives start off a little different than Dr. Berry's. I have a couple of announcements, and I'm going to run through them real quick. I'm going to introduce my guest, and he's not actually on yet. He's wrapping up with a patient this afternoon, and is running just a few minutes late. So first off, if you don't know me, like I said, Amanda Decker. I'm at Clear Path Medical. If you need a provider that practices keto, carnivore, ketovore, all those things, I am here to help. I'm licensed in 22 states. You can find that list on my active Facebook page, and we are currently updating my website, clearpathmedical.net, to have all of those on the website for you to see and easy to see. But if you need to connect with a provider, please reach out to me at contact@clearpathmedical.net. I would happily assist you if I'm in your state. So here's my next announcement. If you are in the Middle Tennessee area on August the 5th, Dr. Berry and I are doing a live community Q&A in Dixon, Tennessee. So if you're anywhere in the Middle Tennessee area and want to drive up, we would love to see you here in person. It's going to be about an hour, hour and a half, opening up to anyone in the community. It is free to attend, but I do need you to sign up so we can have a head count, because I have a room cap of like 120 people. So if you're not signed up, you can't get in. But there's still room, and August 5th. Can't wait to see you there. So please hop on. And then if you haven't heard about it, in September, I do this amazing event called Low Carb for Better Health. It's our 4th year. There's around 300 people there, all like-minded, keto, carnivore, supporting each other with some amazing speakers. And the person that is going to be joining me today will be there in person talking about heart health and what that means. So sign up at lc4bh.com, get your tickets, get your lodging. It's at a beautiful state park. And if you don't get your lodging ahead of time, you're probably not going to get a room there. And it's attached to the venue. So you want to stay at the park. It's beautiful. So join us September 12th and 13th. It's going to be a great time. And all of my channels are at Decker Less Carbs. So if you have not followed me, YouTube, Facebook, Instagram, Twitter, all those, please go on and follow me and give this recording a like so that it can help me out in the future. So on with the show. Just like with Dr. Berry, if you have questions, please put them in the comments and we will get to them in due time. But I'm going to do a little chat with our guests first, just to get some intro, some background, and let you guys start formatting those great, good questions that you have. So today joining me is Dr. Philip Ovadia. He is a board certified cardiothoracic surgeon and founder of Ovadia Heart Health. He is also an author of the best-selling book, Stay Off My Operating Table, a heart surgeon's metabolic health guide to losing weight, prevent disease, and feel your best every day. I have personally read this book. I've enjoyed it. I've shared it with multiple patients. I've shared it with my family members. It is easy to read, easy to understand, and I highly recommend that you go check it out and read it. So after years of struggling with obesity and pre-diabetes, he transformed his own health by adopting a low carbohydrate diet, an animal-based low carbohydrate diet. He's lost over 100 pounds and reversed his personal metabolic health issues. This experience, it inspired him, like it does so many of us healthcare providers, to do a shift in his career. And he shifted a little away from the surgical side of things and more into the clinic side of things, going after people proactively to improve their metabolic health. His practice is Ovadia Heart Health, or Ovadia Heart Health, depends on how country you are when you're saying it. And it is a telehealth practice dedicated to preventing and treating heart disease through lifestyle and dietary modifications. So everybody, please welcome Dr. Philip Ovadia. Hi, how are you?
It is awesome to be here with you, Amanda. It was so great seeing you in person this past weekend, and look forward to doing it again in September at Low Carb for Better Health. It's going to be an amazing event, and definitely encourage everyone to get your tickets now for that one.
Yeah, we've sold out the last 2 years. So if they wait till the last minute, they're probably not going to get in on this event. So it's a very unique experience. For those of you that don't know, we were at Meatstock this weekend. It was a wonderful time. I mean, it just, what amazes me about this community is how happy we are. You go to so many events and people are at each other's throats. If you run out of food or it's too cramped or something, all you get is bickering. And every event I've attended, I've not had it. I've not seen it with this group. We're just happy to be together. It's like a big family.
Yeah, definitely so. I know the organizer of that event was a little, stressed. Yesterday, I was speaking, and some other speakers needed to rearrange their schedule, and he was kind of all, worried. And I was like, "Don't worry about it, man. It'll be all good."
Yeah.
And but you're right. It is such a positive environment.
Yeah.
Just the power that comes from being in a healing community. People that are all kind of working towards the same goal and
Mhm.
really have that hope. And what I talk about often is how sad it is that within the traditional healthcare system we've really lost hope.
Oh,
The
absolutely.
message to the patients is you can only manage your disease. We can only kind of prolong things, or try and push off some of the end stages that are going to come from this disease. And
Mhm.
you come to the low carb carnivore community, and it's about reversing disease. It's about
Mhm.
empowering people to take charge of their health. And
Mhm.
it's just such a positive, uplifting, community that you can't help but get inspired when you're around these people.
Yeah.
And like you, I enjoy the meetings so much, and I really, to be honest, can't stand going to traditional medical meetings anymore uh, after going to all of the low carb events.
Oh, yeah. Yeah. I've been asked by many of my colleagues if I'm going to head back into like the Obesity Medicine Association meetings because I am a member there. It's where I got my first advanced credentials when I went into metabolic health. But it's just about meds. You go and it's all about meds and it's all about money and who's seeing the most people. And I'm over that. I'm over it. I'm ready to help people be better. And it's not there in the traditional medicine in any way anymore.
Yeah, definitely so. And then of course, you can't beat the food at a low carb carnivore
Oh,
event
no.
either, man. Uh,
Yeah, we
not
had
not that I
steaks and
ever
burgers this weekend. Like, this is awesome.
Yeah, not that I ever get my fill of steak or burgers, but I definitely stayed quite satiated throughout the
Mhm.
weekend, so it was awesome.
Yeah, absolutely. So we chatted for a hot minute this weekend before we got distracted in other things. But what I'm getting asked about a lot in clinic is I'm low carb now. Do I worry about my cholesterol? And I was watching people interact with you, and I feel like that's the question you get asked all the time. Do I worry about this? What should I be concerned? And it really is a very layered, complicated question. You can't just answer it in 5 minutes. Let's start with, should people fear cholesterol?
Yeah, you shouldn't fear cholesterol.
Mm.
Cholesterol is something that is essential to life. We literally would not exist without cholesterol.
Mhm.
And really, nothing in nature would exist without cholesterol. Cholesterol
Mhm.
makes up the structure of our cells.
Mhm.
It is what allows us to exist, like I said, as human beings, but really as everything in the animal and plant kingdom does have some form of cholesterol.
Yeah.
Notable that plants have a different form of it, and that might be part of the reason why the plants don't necessarily agree with our digestive system and our metabolism. Cholesterol plays many important roles in our body.
Mhm.
Again, if you listen to sort of the mainstream messaging around cholesterol, you would kind of get the impression that um, for whatever reason, our bodies are making this substance only to
Mhm.
kill ourselves,
Yeah.
right? It's only kind of the only place that it shows up in the body is in the plaques and the arteries that lead to heart attacks. And
Yeah.
nothing could be further from the truth. Cholesterol is an important part in our immune system. It helps
Mhm.
us fight off things like infection and cancer.
Mhm.
Cholesterol is a precursor to many of the important hormones that our
Mhm.
body makes. This
Mhm.
includes our sex hormones, things like
Mhm.
testosterone and estrogen and progesterone. This
Mhm.
includes vitamin D, which, by the way, is a hormone, not a vitamin, despite
Mhm.
our thyroid hormone. It all is made from cholesterol. And
Mhm.
so cholesterol is vital. We shouldn't fear it.
Mhm.
Now, we also shouldn't ignore it.
Mhm.
It needs to be understood, and it needs to be, I would say, managed in the right way.
Mhm.
And it's not a blanket lower cholesterol at all costs.
Yeah.
It's understand what role it may or may not be playing in your body, what the real difference is between truly dangerous, bad
Mhm.
cholesterol
Mhm.
and the good cholesterol that's having benefits. That's where the nuance comes in. And
Mhm.
you're right. It is the most common question I think that gets asked. And what's interesting is cholesterol is probably the strongest argument that gets put forth against things like low carb diets and especially a carnivore diet. And as we can kind of dig into, there's this false impression that everyone on a low carb diet sees their cholesterol levels raise, and then
Mhm.
that's necessarily a bad thing.
Mhm. Yeah, and what people don't realize is the majority of people see improvements in their cholesterol. I've seen personally that the longer people stay low carb, you tend to have that higher elevation, and it's typically because we get leaner, and that's a different pathology in the body. So when you're approaching this with a client to help them understand the cholesterol and their overall heart health, what other things do you look at other than just that number to help them get that big picture of that heart health?
Yeah, well, the first thing is look at that full cholesterol panel, right? Most of
Mhm.
the time, the doctors, right, will only focus on that LDL number.
Mhm.
And there are other numbers on there. There's the triglycerides and there's the
Mhm.
HDL cholesterol.
Mhm.
And those are very important numbers.
Mhm.
And in general, uh, people that have insulin resistance, they
Mhm.
tend to get a high triglycerides and a
Mhm.
low HDL. And we
Mhm.
want the opposite, right? We want
Mhm.
the high HDL and the
Mhm.
low triglycerides. And so that's very important to pay attention to.
Mhm.
And the other factors that are going to be important are looking at things like insulin resistance,
Mhm.
your fasting insulin level, and we can talk about there are a number of different ways to assess insulin resistance. I know.
Mhm.
I know Ken talks about those often, so we might
Mhm.
not need to go into too much detail there. But insulin resistance and inflammation are very important as well.
Mhm.
And the reason that they're important is that is starting to get to the root cause of
Mhm.
cardiovascular disease, what we call
Mhm.
atherosclerosis, this
Mhm.
plaque in the arteries that everyone's worried about. Before you can get a buildup of plaque, you need to have damage to your arteries,
Yeah.
damage to the endothelium, the lining of those blood vessels. And things like insulin resistance and high blood sugar are one of the major causes of that damage.
Mhm.
Inflammation, again, is going to lead to damage in the blood vessels. Things
Mhm.
like smoking are going to lead to damage in the blood vessels.
Mhm.
So, the before the cholesterol could even become a problem, if it is
Mhm.
going to be a problem, you need the damage to your blood vessels first. And so let's focus on that and let's make
Mhm.
sure we don't damage our blood vessels, and then the cholesterol becomes less of a concern.
Yeah, yeah. I've often used the example in my clinic that cholesterol is responding like an ambulance to the scene of the crime, but something else triggered that scene to happen. And if we don't fix that scene, we can take your LDL as low as you want it, but it's whatever's in there is still going to be showing up, responding to that. And inflammation is one of those big triggers that is sometimes hidden and people don't even realize that it's there. What are your main inflammatory markers that you draw?
Yeah, C-reactive protein is really
Mhm.
the big one. We can look at something like ferritin,
Mhm.
which is kind of a dual marker, so that can make it a little tricky in interpreting it. Uh,
Mhm.
Elevated ferritins can be a result of inflammation, but they can
Mhm.
also have to do with the iron status in the body.
Mhm.
Um, Other inflammation related markers that I like to look at are uric acid and homocysteine.
Mm.
Homocysteine is really, again, an underappreciated and misunderstood one that does
Mhm.
have a relationship to heart disease. So
Mm.
that's a big one for me. And then, because of my focus on heart disease, I sort of get deep in the woods. There are two measures of blood vessel specific inflammation that I look at with my patients. One is
Mhm.
called myeloperoxidase,
Mhm.
MPO, and the other one is called LPPLA2, not to be confused with LP little
Okay,
a.
really.
But LPPLA2 is another indicator of inflammation within the blood vessels. And, this starts to get pretty nuanced. So if you're going to be looking at those things, you probably want a practitioner that understands what they're looking at. It's not, those are kind of tests I'd always say you probably don't want to go ordering those on your own
No.
because they can be a little bit tricky to interpret.
Yeah, yeah, and sometimes scary when you get tests like that and you're not sure what to do with them, then you have no one to ask, "What does this mean?" So
Yeah.
I often get an advanced lipid panel or NMR on
Yep.
my patients, looking at the small, dense, and large. It also gets ApoB and LP little a, which you just brought up. How are those things useful when people are interpreting their numbers?
Yeah, so that starts to get into the quality of the cholesterol is how I
Mhm.
talk about it, and that's very important as well. Because if
Mhm.
you have a lot of cholesterol, but it's good quality cholesterol, we
Mhm.
don't need to worry about it, and there isn't going to be any benefit to lowering it or treating it.
Yes.
Looking at those particle sizes, and
Mhm.
you will see on that NMR report. Depending which lab you're looking at, it's probably going to report an LDL size, and then
Mhm.
it's going to say something like pattern A or pattern B.
Mhm.
And in general, you want and these are the LDL particles that we're
Mhm.
talking about in particular, you want them to be larger.
Mhm.
You've probably, many people will have heard myself and others talk about the large fluffy particles or the large buoyant particles versus the
Mhm.
small dense particles. And
Mhm.
it's actually only the small dense particles that get involved in plaque. Those
Mm.
are what we call atherogenic,
Mhm.
meaning that they're in the plaque. The
Mhm.
large fluffy particles don't. Now, ApoB, which
Mhm.
is kind of become, I'll say, the favorite marker of the traditional lipidologist.
Mhm.
ApoB can be tricky as well because
Mhm.
ApoB suffers from the same problem that just looking at the LDL level does.
Absolutely.
And that's you don't know the underlying quality
Mhm.
if you're only looking at the ApoB. If
Yeah.
your ApoB is high, that can be a lot of these small, dense, problematic particles,
Mhm.
or it could be a lot of the large, fluffy, not problematic particles.
Mhm.
Now, ApoB also takes into account some other types of LDL
Mhm.
particles, specifically the VLDL particles. And the VLDL particles are generally problematic.
Mhm.
So, the more of those you have, the more of a problem you might have. And
Mhm.
so that's why ApoB becomes a little bit better than just looking at LDL, but it's
Mhm.
still not great. And I really, again, just looking at an ApoB level doesn't tell me the information that I need to know.
Yeah. Yeah, for sure. And the LP little a?
Yeah, LP little a is its own special type of lipid particle. It's
Mhm.
actually an LDL particle, but
Mhm.
it's got this extra protein on it that makes it sticky.
Mm.
So it interacts with the blood clotting system. And
Mhm.
so elevated levels of lipoprotein A are problematic, not
Mhm.
because it's a cholesterol molecule, but because of this blood clotting risk. And
Mm-hmm.
so for patients with elevated LP little a, which is largely genetically determined,
Mm-hmm.
the strategy there becomes doing something to mitigate blood clotting.
Yeah.
And it also makes it even more important to avoid inflammation, because we know that combination of LP little a with inflammation is particularly problematic.
Yeah, absolutely. I'm glad we're on the same page. Makes me happy.
Indeed.
So let's just kind of pose a general situation that I think that it would apply to a lot of the people watching, a lot of the people I see in my clinic. They live the standard American lifestyle for 30, 40, 50 years sometimes. Then they convert to low carb and they see a lot of things improve, but they are the one where their LDL goes up. Then they might go and get a CAC score, coronary artery calcium score, and let's just say it's 500, which is an elevated number. Their cardiologists and their PCPs are going to freak out. They're going to say, you got to run and you got to quit this diet and you have to start a statin. And we might even need to start a shot like a Praluent or something like that to lower your cholesterol levels. We got to do everything we can to get down there. It's a knee-jerk reaction that doesn't necessarily help much. How do you help that person work through and look at, this is your scenario, and yeah, we can't reverse everything you did before, but we can make it a whole lot better moving forward?
Yeah. So, a couple of things that you want to assess there. One part of it is, okay, we got this first scan and we don't know when this plaque occurred, right? So part of this becomes, is there active plaque formation? And that's where I'll oftentimes want to get a repeat scan, let's say a year later, to see, is that calcium getting worse or not? Generally, what we know about calcium scores, the absolute number, right, the 500 or whatever it might be, tells you one level of risk, but then the progression over time tells you another level of risk. And when you look at the studies done on coronary calcium scans, on average they go up 10 to 20% per year. If they go up by less than that, if they only go up 5% or they don't go up at all over a year, that puts you back into a low risk category. Even if your score is elevated, the progression over time has actually been shown to be a more significant predictor of risk.
Wow.
So that's something to keep in mind. And then, the other thing to keep in mind is just what led to that plaque forming in the first place. And again, that brings us back to things like insulin resistance, inflammation, diabetes, all of which are generally improving on low carb carnivore diets. So having an elevated CAC doesn't mean that you should stop this diet. If anything, it is reinforcement of why you're doing the diet. And like you said, if you had 50, 60 years of not doing this diet, you can't all of a sudden blame the 1 year of a low carb carnivore diet when it's more likely that it was the things that you've now started to reverse. Depending on how high the score is and some other factors, you might want to get a more advanced scan, something called the CT angiogram, so we can get more detail about what's going on in the blood vessels and, help inform us about how worried we need to be today. And the last thing I'll mention is it's important to note that statins generally cause worsening calcification in the artery. So it's always interesting to me when someone, has an elevated calcium score that doctors are worried about. And then they say, well, the answer is a statin, even though the statin makes that calcification worse. But somehow in their mind, that leads to it being better. And it's not something that ever really made sense to me, but it's the discussion that actually goes on within the cardiology community.
Yeah, I've had cardiologists still tell me that statins don't do that. I'm like, how? But what? It's like I've read the research and I've seen it, and that's one of the ways that it works is to take soft plaque and harden it. And okay, so,
yep.
Let's see. I had another question. Where did it go? Been a long clinic day already. Well, let's just move on then. What are your top three things that you tell people? This is what we need to do to make sure that we stay metabolically healthy, heart healthy wise. If you could tell them top three things that you would recommend to every client, what would that be?
Yeah, so it's really going to be eating a whole, real food, low carb diet is
Mm-hmm.
number one, and that can come in many flavors from low carb, keto, carnivore, and they all can be they're all acceptable. One of the I think the main parts of my messaging is that carnivore may not be necessary for everyone, but carnivore is perfectly safe to do for your heart.
Mm-hmm.
So you don't need to fear carnivore because of your heart.
Yeah.
And then number two is going to be get the right amount and right kinds of activity.
Yeah.
And for me, I really focus first and foremost on building and maintaining muscle with resistance exercise, and cardio can be great as an additive as well.
Mm-hmm.
And then probably number three is going to be, getting a good amount of sleep and good
Yep.
quality sleep,
Awesome.
which becomes very important to overall health, insulin resistance, and heart health in particular.
Yeah, man, that last one, people underestimate so much how important rest is. And I'm going to thank Coach Marcia because she remembered the question that I had in my head and couldn't remember after we got done talking. So, is there a possibility of reversing an elevated CAC score? If so, how?
Yeah, so in my patients, I have seen some lowering of CAC scores.
Hmm.
I've seen people that have been able to lower it maybe in the 10, 15, 20% range.
Hmm.
You're not going to go from 500 to zero. But
Hmm.
like I said earlier, the real important thing about your CAC score is stop it from getting worse.
Yeah.
Because if you're in a situation today that your score is whatever it is, and you're not needing a stent or you're not needing bypass surgery, as long as we stop that score from getting worse and that plaque isn't continuing to progress, you will be all right for the long run. So my main goal is stop it from getting worse,
Hmm.
but there is some reversal that we see. And the main things that come to reversal are, that lead to reversal are reversing insulin resistance, eliminating inflammation.
Hmm.
Those are really the two big ones.
Hmm.
Looking for maybe some hidden factors that can be driving plaque formation.
Hmm.
And these are things like, uh, other toxic exposures besides just, you know, seed oils, carbohydrates. I think most of the audience probably knows about those, but, things like heavy metals, things
Hmm.
like mold or chronic
Hmm.
Lyme infections, periodontal disease. These
Hmm.
can be some hidden drivers of heart disease that you want to, be thinking about and eliminating if needed. And
Yeah.
then there might be some role for supplements as well. And the
Hmm.
ones that I would say we have the best evidence for, nattokinase. So
Hmm.
nattokinase is a natural blood thinner,
Hmm.
essentially, helps to break down blood clots. And
Hmm.
nattokinase has been shown in a trial to reverse plaque
Hmm.
in arteries. Now, the caveat is the trial was looking at the carotid artery, the plaque in the neck,
Hmm.
wasn't looking at the coronary arteries in the heart.
Hmm.
But, it's some evidence that nattokinase may be helpful. And then
Hmm.
vitamin K2 is
Hmm.
another one that can be helpful. And again, if you're eating a meat heavy diet, you're probably getting a good amount of vitamin K2 in that
Hmm.
diet, but it doesn't hurt to supplement it for people with plaque.
Yeah, absolutely. And I can attest that Dr. Ovadia is not just about putting you on so many supplements that you feel like you've just come back from the doctor on 10 different medicines either. And, when he recommends it, it is truly a supplement that can be helpful. And you're not going to walk away like with a bag of 20. That's not your goal, is just to put people on a ton of those things. So we have another heart like question from Angela. I have a 45 millimeter ascending aneurysm. Is there any chance it could shrink? I have had it stay stable for 3 years now.
Yeah, this is a great question. So Angela is referring to the aorta, the main blood vessel coming out from the heart.
Mhm,
And that first part of the aorta is called the ascending aorta.
mhm,
And we worry about aneurysms, which are enlargements of that blood vessel. Over time, as the blood vessel enlarges, it can get weak and it could tear and lead
mhm,
to what we call an aortic dissection, which is a devastating condition, high
mhm,
mortality rate, kind of surgical emergency
mhm,
that can occur.
mhm,
In general, with aneurysms, again, the goal is to just make sure it doesn't keep growing. We occasionally see it getting a little smaller.
mhm,
So for the aorta, generally about 3.5 centimeters is considered the normal size, up
mhm,
to. It's going to vary a little bit depending on the size of the patient.
mhm,
About 5 to 5.5 centimeters was where we really start to worry about them, that the risk of them dissecting and rupturing can go up.
mhm,
But I see many patients that for many years will stay stable. And I think the keys to it staying stable
mhm,
are first of all, making sure that your blood pressure is well controlled.
mhm,
And again, ideally, you use something like a low carb carnivore diet so you can reverse the insulin resistance that's causing the high blood pressure in the first place and
mhm,
maybe be able to get off your high blood pressure medications. But
mhm,
with an aneurysm, you really want to make sure that blood pressure stays well controlled. And
mhm,
then it seems that inflammation, has something to do with these aneurysms as well. So you
mhm.
want to make sure that you're keeping inflammation under control.
Yeah, absolutely. So Miss Lynn is 5'4", 64 years of age, and weighs 150 pounds. Her CAC, she lists two scores, 271 and 237 in LAD. Ketovore for 2 years. Blood pressure is good unless she's under high stress. What else can she do to protect herself against things like stroke?
Yeah. So again, you really want to make sure that that insulin resistance and that inflammation is addressed. And this is
Mhm,
something that is important. You can't just assume, even
mhm,
if you've been on a good, ketovore, carnivore, low carb, whatever diet it has been,
mhm,
that the insulin resistance is reversed. The reality is that sometimes it takes a long time. If you've had 50, 60 years of insulin resistance, it might take a few years for it to completely reverse. And that's why I think it's important to be checking these labs, working with a practitioner who understands this. So you really make sure that, that those factors are being addressed. And
mhm,
then, we talked a little bit earlier about some of the other things that may come into play, but
mhm,
insulin resistance, inflammation, getting good sleep, managing your stress,
mhm.
all important things.
Yeah, yeah, that's what I was gonna add, and I encourage a lot of breath work for stress because we can't avoid stress. It's just part of life. It's gonna happen at some point in your day. You're gonna see some level of stress. So there's this little device called the relaxator that it forces you to slow down your breathing, or even something as simple as box breathing can help in that moment of stress and can lower blood pressure, a little bit in that moment. So 100% agree with that. So there's another question that is a little it's not quite cardiac, but I think you're smart enough to still do this one. I have concerns if I can do keto with stage 3 CKD. How much protein can I have? And I think she posted a question earlier just about doing keto in general with CKD. Do I have to worry about my kidneys, things of that nature?
Yeah, so not only can you do keto with stage 3 chronic kidney disease, you should do keto with stage 3 chronic kidney disease.
Mm-hmm.
Um, Reverse insulin resistance is the primary driver of chronic kidney disease. And so reversing insulin resistance with a low carb ketogenic diet is going to help stabilize and possibly improve that. And again, we have data on this now, showing that ketogenic diets do not harm the kidneys and may help the kidneys. David Unwin published his data showing kidney function improving in his patients on low carb diets.
Mm-hmm.
No reason not to do it. How much protein can I have? The answer is uh, as much as you need, right?
Mhm. Yeah.
You should be targeting good amounts of protein, be able to build muscle, which again is going to further help improve the insulin resistance. Now,
Yeah.
one maybe nuance to look out for here. The most
Mhm.
common blood test used to measure kidney function is
Mhm.
creatinine.
Mhm.
Um, Creatinine can be influenced by dietary protein intake.
Mhm.
So you may want to ask your doctor. There's an alternative way to measure kidney function. It's called cystatin C,
Mhm.
cystatin, big letter
Mhm.
C.
Mhm.
And that is not influenced by dietary protein. And so you
Mhm.
may just want to, one of the reasons why this sort of false belief that protein harms the kidneys is because people on high protein diets will have may have higher creatinine levels,
Mhm.
and but the creatinine level in that situation does not actually equate with kidney function in the same way that we assume it does. And
Mhm.
so that's one little nuance for patients with kidney disease that are doing higher protein, low carb diets.
Yeah, absolutely. All right. My husband is 54 years old, high blood pressure on lisinopril slash HCTZ, that's hydrochlorothiazide for you non-medical people. It's a diuretic, 20-25 amlodipine, 10 milligrams. He's lost 100 pounds doing carnivore keto. Way to go, husband. In the last 3 years. How long before he'll notice lower blood pressure? Also, his weight loss stalled after about a year.
Yeah, so that's a great question. The answer is he may not notice lower
Mhm.
blood pressure. However, that doesn't mean that he can't uh, reduce his medications. One of
Mhm.
the interesting things that I see in some patients is they don't get the low blood pressure necessarily that kind
Mhm.
of forces us to take them off of medications. But if you start dialing back the medication in these patients, their
Mhm.
blood pressure really doesn't change.
Mhm.
So it's really a matter of the medication wasn't doing anything to start with,
Mhm.
wasn't harming them, but also wasn't helping them. And
Mhm.
I'm oftentimes able to gradually get people off blood pressure medication,
Mhm.
even though they may not have the sort of dramatic lowering of blood pressure that other people get when they go on low carb diets.
Yeah. And side note, coming off some of those blood pressure medicines may see the weight loss trigger back in again because there's some weight gain potential with specifically like that amlodipine. Would you use something like fasting in this situation? Encourage them to maybe extend or play around with fasting? What is your general thoughts there?
Yeah, so when people are dealing with sort of weight stalls, there are a couple of things that I usually am going to look at.
Mhm.
I would say the three levers that I start thinking about is first of all, what's your activity level and how is that matching up with what you're eating? Because
Mhm.
sometimes we see situations where patients are getting very active, they're not eating enough to fuel their activity, and that
Mhm.
kind of gets the body in a little bit of a weight stall.
Mhm.
I'll look at the fat to protein ratios,
Mhm.
and sometimes you need to play around with those a little
Mhm.
bit. And then, yeah, I do think fasting can be a great tool, right?
Mhm.
With the caution of what we just talked about. If you're
Mhm.
undereating to start with,
That's
you
true.
don't want to go adding more fasting to that situation. So,
Mhm.
and there's no magic answer. There's no answer that's always right. Those are just sort of the factors that you have to start to think about, work with your
Mhm.
practitioner on. And sometimes it's just a matter of, experimenting.
Mhm.
Sometimes the body just needs some variety, right? And you've been doing
Mhm.
the same thing now for a year, 2, 3 years.
And we're not talking variety donuts here, people.
Yeah,
Not
no,
that
we're not talking variety in terms of reintroducing processed food, but just shaking it up in terms of how much you're eating, when you're
Mhm.
eating. The fat to protein ratio, like I said, can get things moving again.
Yeah. All right. This question is basically, do you have some hints for someone who may have had a weight loss surgery that's struggling to get their protein in and they want to know if just eating enough butter on things is going to be sufficient?
Yeah. So, first of all, it is very important to get your protein. And if you've had a, a gastric bypass of some sort, keep in mind that you might not absorb things as well. And
Yeah.
so, you want to get that extra protein. This is where, many times, right, carnivores tend towards 1, 2 big meals a day.
Mhm.
And this is a situation where sometimes doing more frequent, smaller meals get that
Mhm.
protein in. Protein shakes can
Mhm.
sometimes, help with this as well. But
Mhm.
again, make sure it's a clean protein shake.
Yeah.
Try and get those. Like I'm a big fan of the beef protein
Mhm.
powders that you can get
Absolutely.
these days. Or just a clean like whey protein, animal-based protein powder can be helpful here. And the fat, again, you do want to be a little careful, because if you go to too much liquid fat
Mhm.
with the absorption issues that come from gastric bypass surgeries,
Mhm.
you can get yourself into trouble with that.
Yeah.
But play around with some of those things. But probably the first thing I would be looking at is just that kind of more smaller, more frequent meals, as opposed
Mhm.
to the usual carnivore approach of pounding a
Yeah.
ribeye.
Yeah,
Yeah.
yeah. It's going to be difficult for them to eat till comfortably stuffed because they eat comfortably stuffed really, really easy.
Yeah.
We use a lot of Equip Food Prime Protein. It's a good beef protein isolate, and the Keto Chow Core line is another good clean beef protein isolate. Both use stevia as their sweetener, which is good. And I also like to recommend softer proteins like eggs, just because it's easier to get through that stomach. So you may not get as much of the ribeyes, but you could still get good quality protein. Is very important. Very important. All right, let's see. All right. 1 year ketovore, 46-year-old male, down 30 pounds. A1C is 6.1 to 5.4. Good job. Triglycerides went from 285 to 98. Another good job. HDL is at 49. Blood pressure is 150 over 102, down to a lower number, 118 over 80. TSH reflex is 4.46. Should I do a full thyroid panel? Also, is the HDL to triglyceride ratio okay?
Yeah, so the first question, the answer is always do a full thyroid panel.
Mhm.
Checking TSH alone, I don't know why it even exists in medicine anymore. You cannot go by TSH levels
Mhm.
alone. You want to get your T4, T3, so definitely do that. Is that HDL to triglyceride ratio okay? You're right at 2 to 1 there. I ideally like to see it less than 1.5, but you've made amazing progress, right? He didn't really say
Mhm.
what his HDL started at, but
Mm-mm.
it
Imagine it was
was,
much lower.
yeah, exactly. So it was probably at least a 5 to 1 ratio. You're now down to 2 to 1. Keep going. And then the other thing, I don't rely on that ratio, right? That
Mhm.
ratio is an indirect indicator of insulin resistance. It's
Mhm.
okay if it's all you got, but
Mhm.
check the insulin level, get the insulin resistance panel,
Mhm.
really see what the underlying numbers look like, is a much better way to go about it.
Yeah, yeah. I can't find the question right now, but building off thyroid, someone asked if they had a TSH of 20.5, is that something urgently that needs to be treated?
A TSH that high can be a problem.
Mhm.
Symptoms, you want to know, are you having symptoms related to that? So a
Mhm.
TSH of that high, normally a high TSH is going to indicate low thyroid function. So you'd
Mhm.
be looking for hypothyroid type symptoms like
Mhm.
low energy, feeling cold, slow heart rate.
Mhm.
But you can also see a TSH that high if you're in the middle of sort of an autoimmune attack on your thyroid. And I would want to check antibodies and be looking for something like Hashimoto's,
Yeah.
which can actually give you hyper or hypo symptoms. So it can be a
Mhm.
little tricky to figure out.
Yeah, absolutely. And there are some cardiac implications from leaving thyroid untreated for too long, correct?
Yeah, definitely. And again, it's on both ends. We
Mhm,
have things like thyroid storm, which is a overactive thyroid that can lead to arrhythmias,
mhm,
fast heart rates, and
mhm,
irregular rates. And then on the low end, hypothyroidism can cause problems with heart function as well.
mhm,
And then another interesting thing for people to keep in mind is um, thyroid function can affect your cholesterol levels as well.
mhm.
And so one of the things that's supposed to be looked for, but oftentimes isn't in people with high cholesterol, is low thyroid function will cause your
Mhm,
cholesterol level to rise. And
mhm.
so that's something to keep in mind as well.
Yeah, absolutely. So, Joanne, my doctor wants me to lower my cholesterol levels. It is 250 and I'm on a ketovore diet. What should she tell her doctor?
Well, you should have the conversation with your doctor on, d- is this enough information, right, for us about my cholesterol? Should we know
Mhm,
about my cholesterol particles? What
mhm.
role does insulin resistance have in determining if my cholesterol is problematic or not? And if you get a blank stare back from your doctor, which you might, because understand the honest truth is most doctors don't know this. They've
Yeah,
never heard it. It's
yeah.
not that they're hiding the information from you. They truly don't know it. So, you always hope in that situation the doctor will be curious enough to
Mhm,
learn. Feel free to point them towards, some of Dr. Berry's videos or some of my videos or give them
mhm.
one of our books or, anything you can do to kind of prompt them to see if they're interested in learning with you, right? If they're curious about this. And if
Yeah,
they're not, and they're just all they can say is, well, the guidelines say, it should be lower, that might be an indication that it's time to find a new doctor.
yeah. No, absolutely. All right. Robert says, I hear that high LDL and total cholesterol not an issue if metabolically healthy, but if not, and if there's already moderate CAC score, thoughts on trying to keep the cholesterol lower through statins.
Yeah, the important thing here is you can't assume that cholesterol lowering alone is going to be enough.
Mm,
And that's the big mistake, right? Because we've
mhm,
been doing that for 40 years. We've been primarily focused on lowering cholesterol. We generally ignore things like insulin resistance and inflammation, and it's led us to exactly where we are. That heart disease is still far and away the number one killer in this country, and it just doesn't work.
yeah,
So yes, you can combine these, and you can reverse your insulin resistance and also stay on these medications. But again, like I said, the studies really show that if you don't have insulin resistance and you don't have inflammation, there's
mm,
no benefit to lowering cholesterol. So I always tell people that your goal is to get you to a point where cholesterol lowering is no longer going to be beneficial to you. It's
yeah,
not we're ignoring your cholesterol. It's not that you're not managing your cholesterol. You have gotten yourself to a point where cholesterol lowering is no longer beneficial. And that really should be the goal.
yeah, absolutely. So this is a 65-year-old female with low sex hormones, low energy, but she has a 0 CAC score, but her natural doctor maybe and her provider won't prescribe bioidentical hormones because my LDL is too high. Thoughts on being on hormones and high LDL?
Yeah, so tell your doctor that it's not the 1990s anymore. This study that led to this fear has been
Mhm,
thoroughly discredited, and it was called the Women's Health Initiative. It was
mhm,
a lousy study that led to this misconception, but we now have plenty of data showing that there is no cardiovascular risk to bioidentical hormone replacement. And even on top of that, if you're a 65-year-old with a 0 CAC score, the chances that you're going to die of heart disease are pretty darn low.
Yeah.
So you're at very low risk for heart disease right now. So there is no reason that she should be fearing bioidentical hormones for you.
Absolutely. It blows my mind. It's like, if hormones were going to cause that heart disease, why did we not have heart disease when we're in our 20s and 30s when our hormones were at their prime? It just doesn't make simple sense in my head.
Yeah, no, and like we said, the study that led to this has been thoroughly, debunked, and your doctor is just working on very outdated data. And again, this isn't like last year or so. This was like in 2000 that the Women's Health Initiative study was discredited. So.
Yeah.
Um,
Yeah. But there again, that's a thing that her doctor would have to go out and search and find themselves, because when HRT was removed, or hormone replacement was removed from medical education because of the Women's Health Initiative study, they didn't really add it back in. So your doctor's not learning about it in college. They have to go figure it out themselves.
yeah.
All right. Cookie says low carb presently, no more than 50 grams for 6 months. How does she start carnivore, and what type of animal protein is the best?
Yeah, just get started if you want to, and what type of animal protein is best? The answer is yes. They all are. Just
Yeah.
pick the one you like, really,
Mhm.
and the one that's available to you and accessible to you, and go with that. And just give it a try. I always tell people that carnivore isn't essential for everyone. It's not
Mhm.
the only way to do this, but I
Mhm.
I do really believe that it's worth trying for almost everyone.
Yeah.
Give it 30, 60 days, see how you feel compared to low carb. I know me personally, I went on a low carb ketogenic diet first. I
Mhm.
lost most of my weight on the low carb ketogenic diet. I
Mhm.
then, decided to try carnivore, and I noticed some persistent inflammation that improved. And then really I stuck with carnivore just because it's easy. I don't have
Yeah.
to think about things, and I enjoy it. I enjoy eating meat. And so I keep eating meat, and
Mhm.
it's done me well over the past 6 or so years now.
Mhm. Yeah, absolutely. It does. It just takes the guesswork out of it. It's not, can I have this? Can I have that? It's like, is it meat? Did it have a mama? Did it have eyeballs? Did it have a heartbeat? If it did, okay, you get to eat it. So, non-cholesterol question. Woohoo! My husband is 74, goes to the ER with his AFib issues, and keeps getting told he has to quit coffee, salt, and no red meat. Have to have fiber and veggies. We keep trying to educate them, and we get nowhere. Speak to AFib and kind of the coffee, salt, meat.
Yeah, so absolutely no data that I have ever seen linking red meat consumption to AFib. So that one they're just kind of, uh,
Mhm.
lumping in the general cardiac recommendations.
Mhm.
Again, fiber and vegetables do not help AFib.
Mhm.
Coffee and AFib is somewhat controversial, although there was a study looking at this a year or two ago that really did not show any relationship to at least moderate coffee intake
Mhm.
with AFib. And salt, again, is kind of the same story that if your salt is coming from processed food, it's a problem. But if
Mhm.
you're putting a good high quality salt on your food, that is not a problem. And we may need more of that.
Yeah.
I've seen many patients improve their atrial fibrillation when they go on low carb carnivore diets.
Mhm.
Inflammation definitely plays a role in atrial fibrillation.
Mhm.
That autonomic nervous system plays a role. And
Mhm.
so, some of the stress techniques we talked about earlier can come into play here as well with improving AFib.
Yeah, absolutely. And just because you have a desire to get off all medication doesn't mean you stop things like blood thinners when you're actively in AFib. We have to be smart and protect ourselves, even though we don't want to be on medications. But I too have seen people improve their AFib with being on keto, carnivore, all of the things in between. There's absolutely no contraindication to being on that. I'm not aware of a single study that says there's a contraindication for doing any of that. Yeah.
Yeah.
So this individual says she's had a doctor tell her that high HDL is bad. Is high HDL bad?
So this came out of there was a study last year that suggested that you may so the general data shows us that higher the HDL is better,
Mhm,
but there was some concerns raised by this study
mhm,
that when you get too high of an HDL above 100 or so, it
mhm,
may represent dysfunctional HDL,
mhm,
and therefore you may lose those protective effects.
mhm,
Honestly, I don't worry about this a whole lot. Um, we don't really have a good way of measuring this. It was sort of,
mhm,
it was like one of these epidemiologic correlational studies,
mhm,
and that concept of this dysfunctional HDL was sort of the hypothesis of the authors, but there was not really evidence to support that. And again, I would say it's very contextual. I can see the concept,
mhm,
of the body will make more HDL if the HDL isn't functioning appropriately, but
mhm,
we really don't have enough data to say that's true.
mhm,
And again, what are you going to modify based on that, right? I wouldn't, if you've gone on a low carb diet and your HDL has gone up. First of all, I rarely see the situation where someone will go from, let's say, an HDL of 30 or 40, when they're insulin resistant, and it will
mhm,
shoot all the way up to, 120, 130. It usually
mhm,
goes up, we hope, to like 60 or 70.
mhm,
There are some people with these genetically higher HDL cholesterol levels
mhm.
that even when they're insulin resistant, their HDL is like 90 or 100. And yeah, maybe that is a problematic situation, but I don't worry about it too much.
Yeah. This was a unique question. I think it'll be easy to answer. Is what's the difference between an interventional cardiologist and any other type of cardiologist? And I could see where this could be confusing because you hear the word interventional and you think they want to do things to change the environment, but you often get told, like this person, just start your statin and do a low fat diet. So, what does interventional cardiology truly mean?
Yeah, so interventional cardiology means that they have done extra training that allows them to do cardiac catheterizations and put
Mhm,
stents in, and the procedures around cardiology.
mhm,
It doesn't mean that they can't do all the other stuff that cardiologists do, manage medications and things like that.
mhm,
So, oftentimes your interventional cardiologist will also be, doing sort of the usual stuff around cardiology, medications and things like
mhm.
that. But they have this extra training that allows them to do the procedures, put stents in, do catheterizations, and do other interventions. The interventions are really procedure.
Yeah.
So you can call it a procedural cardiologist, I
That
suppose.
would be less confusing, I think, to people because they just think the connotation is they're going to do something to fix me without all this extra stuff.
Yeah.
Yeah. Okay. Are you going to be at Low Carb San Diego in August?
Actually, as of now, I'm not planning on being out there. However, sometimes things change for me. And
Yeah.
last year, I kind of made a last minute trip out there. I do tend to, because I live in Florida, the low carb Boca meetings in January usually work out better for me.
Yeah.
So there's a chance you'll see me there, but I'm not planning on it
Yeah.
as of now.
I am not either because I am planning to be at Low Carb for Better Health just a couple weeks down the road from that. And since I'm organizing that event, I will be like a chicken with my head cut off trying to make everything flow. So there's no way I can make San Diego happen, even though I love it, which is a great time to say, get your tickets. You can come see both of us at Low Carb for Better Health in beautiful Middle Tennessee at Montgomery State Park. And the website is super easy, lc4bh.com. Don't wait to get your tickets. You should get them now. And we're going to do one more quick question and then we will sign off for the evening. Let's see if I can find one. All right. My cardiologist said CAC over 95% is useless since I have already been diagnosed with heart disease. He says they only get worse. What is your opinion? Basically, is a CAC still useful after you've already been diagnosed with heart disease? And what other tests might you order in that case?
Yeah, so like I said, the progression of CAC over time is a very important predictor, and so that's why I do not think that repeat CACs are useless.
Mhm,
And as I mentioned earlier, I have seen it reverse.
mhm,
I have seen it stabilize, which is what's more important.
mhm,
If you're concerned, if you want a more detailed look at the arteries of the heart, the CT angiogram is the test
mhm,
to get in that situation.
mhm.
But CACs are still useful, even if you have a score that's elevated. You still want to know about that progression over time.
Yeah, and there's pretty low risk. They're non-invasive scans, and most of the time they're under $100, so a very affordable test for most people. It gives you some good, wonderful information. So, thank you for joining me on my first endeavor to be Dr. Ken Berry on Monday Night PhD Live. Since he's off doing his civic duty, trying to make Tennessee healthy again. It was wonderful to see you this weekend. I can't wait to see you in September at Low Carb for Better Health. And thank you, everybody, for joining us and making it a wonderful first event for me. And join me next month. I'll be back.
Man, I wish I could be Dr. Barry sometimes as well, right?
Could try to make like a funny I'm Ken Berry. I did that with the low carb videos last year. He tried to act like me and I tried to act like him. And we made a blooper reel out of it because it was both of us being ridiculous. All right.
Very
You have a
good.
great week.
Great seeing you, Amanda.
Bye.